This park around her retirement home was Susan's sole horizon during France's first lockdown. The 91-year-old found herself cooped up, alone, in her little room with no visits allowed.
I really felt like I'd been sentenced and imprisoned. I wasn't even allowed to walk in the corridors. My meals were brought to me every morning, lunch and dinner. I had no contact with anyone, nothing. It was awful. This is just not possible, I thought. I would have thrown myself out of the window if it hadn't been locked.
Susan was left traumatized by these months of extreme isolation.
It left a deep mark on me. I can still feel it. I still can't really express what I felt in those moments.
Susan started seeing a psychologist this autumn. Emotional distress can cause very tangible damage to the health of elderly people. Symptoms are well documented.
In extreme cases, we witness a syndrome known as geriatric cachexia. At that stage, the patients lose taste for life. They slip away. They stop eating, hydrating, walking. It's a genuine medical emergency. That's why social contact is so essential to avoid this kind of deep depression.
Faced with a potential mental health crisis, the French government decided to allow visits to retirement homes during the country's second lockdown.
Oh, t'as eu un shampoing ce matin, c'est bien ça. Ils t'ont coiffé? C'est vous qui l'avez coiffé?
Christian visits his mother regularly.
Il a du mal à tenir ton truc là.
And Marcelle, aged 94, lives for these moments of complicity.
I know he's coming, so I wait for him. You're here, and that's everything to me.
Rules are strict. 2 one-hour visits are allowed per week.
Before the coronavirus, I used to visit at least 3 times a week. When they reopened, they put 2 tables between us. She would sit over there, we'd talk, we couldn't hug or anything. It was really difficult. When visits were forbidden, it was a catastrophe. My mother would tell me, what's better, dying of COVID or of sadness?
Social isolation doesn't only happen in retirement homes, it also affects the elderly who live by themselves in their own houses. The French NGO Petit Frères des Pauvres has recently issued a report, and the figures are alarming.
Over 700,000 people over 60 had no contact with their family during the first lockdown, and 650,000 people had no one to confide in. The lockdown has been tough for all of us. Can you imagine having no one to talk to?
To fight isolation, the NGOs launched an operation called Paris en Compagnie, or Paris Accompanied. The goal is both to encourage the elderly to walk and fight their loneliness. Rosemary is 89. She signed up a couple of months ago and met Eloise, 22.
We got on right from the start. I found her very kind.
It's true, we had a nice time the first time we met, so we decided to see each other again.
The 2 women walk along the canal once a week. A breath of fresh air for Rosemary, who is a widow, has no children, and has recently lost her sister.
Sometimes I cry, then I get over it.
The lockdowns have added their dismal atmosphere to her loneliness.
Even just the noise, the opportunity to watch people passing by, to watch anything really. In lockdown, everything is totally dead. You don't hear anything. You're completely isolated. Even when you don't go out, you feel stuck. I'm not complaining, but sometimes it's hard to cope.
Loneliness strikes outside large cities as well. In Sarreguemines, a small town of 22,000 in eastern France, Chantal, a volunteer, visits senior citizens who live by themselves. Antoine is a widower with no children. He used to enjoy his social activities before the lockdown.
Sometimes we'd go on outings, or we'd have afternoon tea and cakes. It's sad. We can't even hold hands anymore.
The pandemic has made the isolated elderly even more lonely. In France, an estimated 300,000 senior citizens are in a state of so-called social death, with no one to talk to.